Yeah, so tonight we're going to play, let's play a game. We're going to play a game where I am going to, I know nothing about TRT. So I'm going to
Okay.
have to come to a professional because I have symptoms of low T, and and my clinic that I go to now is recommending me some things that I want to. So I guess it would almost be like a consultation.
Okay.
So if I'm, I have some questions and stuff, and I'm not so certain of my the clinic that I'm going to. I mean, the guy is a part-time bartender and an amateur tattoo artist, but he also does hormones. That's pretty much how this shit's going.
Nice.
Yeah.
Does he have
So
an affiliate link?
yes, he's got an
Okay.
affiliate link. Yeah, exactly. That's exactly the link is
I just needed
in
to
his
know.
bio. The link is in his bio.
Link is in his bio. Okay.
All right. So I am concerned about estrogen with TRT, and I'm concerned about, the crying and stuff that you're told, and gyno,
Okay.
and um, I have no symptoms of it, but but they're recommending that I take an aromatase inhibitor. You think that I should do that?
So, um, we will talk about that. And I know we've talked about that a lot, but I know it's a question that comes up a lot.
It sure does.
Um, when clients come for consults at my clinic, um, everybody gets kind of the same format. And I do that because there's things I want them to know. And it takes a little while, and it's funny because I feel like a school teacher sometimes because I'm literally giving like the same talk
Right.
multiple times a day sometimes, you know, when
Like
you're
one
like,
class leaves, the next class
right,
comes,
right.
you
I
just
mean,
repeat.
right. So
Yeah.
like it's different because everybody has different questions. So it's not exactly the same, but what I'm getting at is the format's the same. I
Hmm.
follow the same structure for every person. Like I'm going to talk about this. I'm going to talk about this. I'm going to talk about this. And we go in order to get down.
Right.
So if you were to come to me for a consultation, and I'm going to answer the estrogen question because it is
Hmm.
part of it, but I just want to kind of give you an idea of the things that we would talk about is the first thing that I go over when somebody comes in. This is after I get their health history, after I get their medications, after I get their symptoms and story, right? I've already gotten the H&P, right?
Hmm.
History and physical is done. We've already spent, 5-10 minutes getting that out of the way. All right. I know the symptoms they have. I know why they're coming to see me. I know if they're a transfer patient and they've been to another, we've explored all that already. Now it's my time to talk, right? Where I'm not asking them questions. Now it's their time to sit and listen and learn because I'm going to explain a lot and we're going to go over it. And there is a quiz at the end. Just kidding. Um, but anyway, because there's a lot. And
Yeah.
so the first thing that I will go over with my patients is the HPT axis. Okay. And I do that because I want you to understand what's happening to your body when, before, and when you go on testosterone. So we talk about that.
Hmm.
And that ends up leading us to talk about testicular atrophy, infertility issues, spermatogenesis, or excuse me, steroidogenesis depletion, and the inhibition of that, and the lack of creating natural testosterone. Okay. That is really what that. I also talk about HCG at this point. Not because I'm trying to sell you an HCG, because it literally works right there.
Right.
So it makes sense. I just bring it in. I do bring that up, but I never put anybody on HCG day one. That doesn't happen. I bring it up and say, hey, listen, this is where it works because I'm literally drawing on my whiteboard.
Hmm.
Okay. So there's visual aids with everything. Okay. That's lesson one. Lesson two, we talk about total testosterone. I'm not going to get into that. Go listen to episode 1. That
Hmm.
talks about everything, literally total testosterone nutshell. The next lesson after that is sex hormone binding globulin. We talk about that. I want people to understand the role of sex hormone binding globulin in your total testosterone, in your free testosterone, and why it matters. Okay. And what do we do if it's too low? What do we do if it's too high? Where do we want it? Why is it relevant? Those are all the things we go over. Step 4 will answer your question. We now talk about estrogen. Okay. And I have my big whiteboard on the screen, and we're going to say, okay, we're going to talk about estrogen now. And I said, what do you know about estrogen? And you're going to tell me what? What do you know about estrogen?
So I personally know that estrogen shouldn't be too high because you can get gyno, and it can cause you can start crying at movies, and I'm trying to think of what other things people write.
Well, I mean, like you yourself, okay?
Oh,
So like,
personally?
yeah, like what do you
Oh,
like? Pretend you didn't move it back 2 years
okay.
ago.
I'm
What
not
did
the
you know
person
about
anymore.
estrogen?
Yeah. Estrogen. Well, I mean, I blocked it in the beginning and
Right.
caused ED. Um, had
But
all kinds of
what did you
issues.
think the role of estrogen was in your body?
Oh, so I thought we needed to deplete it completely. I thought
Because
it
it
would
was a
need
negative,
it was a
right?
right. It was a
Because it's
woman's hormone.
often poor, right? It's a women's hormone. Men
Right.
don't need estradiol. We shouldn't need it. There's
Hmm.
some magic 10-to-1 ratio that I still can't fucking find out where that exists, but
Yeah, that is a weird. I
it's out
hear that
there.
sometimes about the
Okay. Yeah,
ratio.
it's bullshit. Um, at any rate, then you start to actually dig into literature and get out of like all the mainstream, I've shoved it in your face for 10 plus 20, 30 plus years, and get into the actual data of what estrogen is. And then you find that estradiol, or E2 as we like to call it,
Mhm.
is just as important in men as it is in women. Women are estrogen dominant, men are testosterone dominant, but they need testosterone, we need estrogen, right? When we're doing HRT in women, are we giving them testosterone? You bet your ass we're giving them a
Yeah.
testosterone. So while I don't give a man per se estrogen, I'm going to help improve those levels by giving him testosterone because
Right.
of the aromatization in the targeted tissues. Okay. Um, Estradiol's role is about 50% of your benefits of testosterone, right? Insulin sensitization, benefit of estradiol. Um, Fat loss via
Hmm.
growth hormone, estradiol mediated. Okay. Libido, estradiol mediated, right? Um, Bone density, estradiol mediated. Endothelial compliance, estradiol mediated. There's a lot that loosely translates into blood pressure. So I don't
Yeah.
get people confused. Okay. The endothelium's inside the vasculature there. But at any rate, okay, estradiol is incredibly important role in the body. Okay. But it is not, and I repeat, is not a systemic hormone in a male. It is in females. They have ovaries. It's made by ovaries to go out and act in their body. In a male, estradiol is made in very specific places in your body where it is used at those places. These are places like the bone, the brain, the liver, the testes. Testosterone is a systemic hormone. So we call it endocrine hormones made by the testes, designed to go out through the body in systemic circulation. This is why we do a serum test to check your testosterone, because testosterone wears many hats. Okay. Step one, bind to androgen receptor. Step two, convert to estradiol. Step three, convert to DHT. Testosterone has many roles. It actually has more roles than that, but those are basically the three main ones. Okay. In order to do those roles, it has to go places. It can't stay stagnant in one place. So it uses your bloodstream to get to those places. Testosterone, let's take the brain. It's rich. Your limbic system is rich in estrogen alpha receptors. Okay. Testosterone is going to make it to those areas in the brain where, in those cells that need estradiol, in the endoplasmic reticulum of those cells, aromatase exists. Testosterone will enter into those cells. A portion of that testosterone will aromatize via that enzyme to estradiol, which will emerge and bind to the estrogen receptor in that local area. If I continue to send testosterone to that area, we will get to a point where we make more estradiol than what is needed at
Right.
that area. We will take up all of those receptors and our body will be happy. And mind you, the receptor is like a lock and key mechanism, right? I can't open the door without the proper lock and key, right?
Hmm.
If I want to have the gene transcription of estradiol to tell my body to do X, Y, and Z, estradiol has to bind to that lock and key mechanism and tell the body, this is what I want you to do. Okay. If estrogen is in your serum, okay, let me back it up a second.
Mm.
because we have so much extra estradiol production. Okay. And I'm not even talking about body fat yet. We're just talking about, hey, we're talking about the brain. If there's nowhere for that estradiol to go into the brain, where does it go? Right? If there's no
Mm-hmm.
receptor for it to bind to, right? And that's why it was created primarily, where does it go? It goes into the serum. Why? There's nowhere for it to go. And your body's like, I don't need it because I have what I need. Now, if you use a piece of estradiol and a receptor is available, then that estrogen that's there that maybe just got created will take it. I like to equate it like going to a concert, okay? And you get into the parking lot and it's full, right? What are your options? Well, you can drive around trying to hope maybe somebody backed out and left
Mm-hmm.
early or whatever. But if there's nothing available and you drive around that parking lot for so long and there's no spot, where are you going to go? You're probably going to end up leaving because there's nowhere to park,
Right.
right? Or you're going to have to go somewhere else, right? But once you leave, you're gone. Like there's no coming back, right? Like you
Mm-hmm.
don't leave and then come back an hour later, right? Like you're just done. Okay.
Mm-hmm.
This is the same thing. So if I make estradiol in the brain and there's nowhere for it to go and it leaves, it doesn't go back there. It's done. It's in the serum. It's out to be eliminated because you're still going to make new estradiol and that process continues to repeat. It's like you're going in a door and you're exiting a door and you're not going through any rooms, you're just going through the hallway. Right.
Right.
And then so you're creating and then you're out. And then once you're out, you're out. We're only taking new guys.
Mm-hmm.
Okay. The other thing too is that serum estradiol, once it makes it there, if you make it in your brain, it doesn't travel to your testes to bind to estrogen receptors in your testes. Because guess what your testes is doing? Making its own estradiol
Mm-hmm.
for its own receptors. And it's doing the same thing that the brain's doing. So what happens is if we increase somebody's testosterone levels, and all of these places are receiving testosterone and they're all making estradiol to be used locally in those tissues. And what's left over makes it into the bloodstream. When I check a blood test, what is it reflective of?
The one
Excess.
that's yeah, right.
Excess estrogen. That and of
Could it be
which,
like, could you call it free estrogen? That's
well,
kind
technically SHBG and albumin does bind to estradiol. Okay, so that's another component. That's getting a little deep. I think we don't need to go
mm-hmm.
super hard on that. But that's the thing. Okay, if I'm measuring estradiol from your serum, from your bloodstream, it is not reflective of actually what's happening at the level that it's created. It's reflective of, yes, I know you're making it, but you have more and it's dumping it into the bloodstream.
Right.
You have to remember too, if it's in the bloodstream, is it bound to the receptor eliciting its effects? It is not.
Mm-hmm.
It's just there.
Right.
Okay. And we only have finite amount of receptors. They're not infinite. You can't, if that were the case, we'd have no estradiol in our bloodstream.
Mm-hmm.
Okay. So it makes it there because there's nowhere for it to go. And you're basically, your body's going to convert it out and you're going to urinate it out through the kidneys. It's basically what's going to happen. Okay.
So Josh, what is the importance of the receptors, like your brain receptors, and getting the estrogen?
To just give you kind of a case. So every receptor is going to be different in terms of the effects that need to be done. We'll take somatrophs, for example. Somatrophs are what make growth hormone. Okay.
Mm-hmm.
In order for your body to actually make its own growth hormone, estrogen has to bind to those receptors near the somatrophs in order to cause growth hormone release. Okay. This is why we see a decrease in IGF-1 in people
Right.
that take enclomiphene. Okay. Why? Because I need estradiol at those receptors to create the lock and key to tell my body make growth hormone.
That's where I was
When
going with that question.
clomiphene, I'm glad you brought it up. When clomiphene takes its place, it does not cause that lock and key
Right.
effect. It's blocking that receptor from having the actual estradiol from eliciting the effect. And therefore, this is why we cannot make relative body composition changes on a SERM, because those effects that are mediated by estradiol are not happening.
Mm-hmm.
Okay. And when we see that with the study with the decreased IGF-1
Right.
from the blocking of those estrogen alpha receptors. Okay. That's how we know it's not working. Okay. But anyway, we get a serum estradiol level. Okay. And we've somehow put this magic number on this waste estrogen product number. Okay. And it's up, I think 40 is the high. Anything over 40 is high.
Right.
Okay. Or 42 or something like that.
Yep.
Um, But what we're really looking at is the trash can, essentially. And I don't know about you, but like I don't look in my trash can to determine like, what I'm going to do, what I'm going to make for dinner. Like I go to my fridge, right? Or my pantry. I'm not
Right.
looking in the trash can. Okay. The second part of this is adipose tissue. Adipose tissue, and people are going to be like, well, fat people aromatize testosterone and estrogen. You are correct. They do. Because adipose tissue does aromatize testosterone into estradiol. Okay. Here's really what's happening. If you have a disproportionate amount of adipose tissue and I give you testosterone, what's going to happen is that testosterone, because it has to go everywhere, is also going to go out to your periphery where this adipose tissue is, and it's going to travel. Okay. Of which you have so much adipose tissue, it's now going to take a lot of testosterone that's traveling to all these different places, and it is going to convert it to estradiol. There is going to be some that's bound to the adipose tissue because you actually need it to lose it. Okay. It's sort of like its elimination mechanism almost, so to speak, right? And then whatever's left over just, again, goes into the bloodstream to be eliminated. The estradiol that you make from adipose tissue, you're not using in your brain. Because remember, your brain's making its own.
Right.
Okay. Like it doesn't travel to your bloodstream from your fat and your belly
Then
to your
go
brain or your liver or wherever. It's just everywhere that makes it is using what it makes. It's not using, whatever makes it into the bloodstream. That is purely going to be eliminated. Okay. There is some other estrogenic processes that estrogen does that are not bound by the receptor, but they're minor. The main goal of it is to bind to a receptor.
Right.
Okay. So I can't sit here and say that like, everything in your serum is not going to work, but it's what I'm trying to get people to take away of this is what you produce in one area is not necessarily used in another area. Right? Like what you produce in your brain doesn't go to your testes to bind to the receptor. Okay. They both do their own thing. That's really what I'm getting at. But since adipose tissue will disproportionately skew serum estradiol levels to make you think that you have a high serum estradiol level. And this can be true even if you're not on testosterone, right? If you have a lot of body fat and you're obese, two things will happen. One, you have some mitochondrial dysfunction at the Leydig receptor, Leydig cells, the LH receptor at the Leydig cell, due to having issues with, glucose regulation. And also because you're fat, the cells are just physically bigger. Okay. We see this with insulin resistance. That's why people, when they're like, lose weight because your cell's this big and insulin needs a cell this big to actually work appropriately. Right. Same thing. So you have Leydig cells that cannot function appropriately because luteinizing hormone cannot bind appropriately to that receptor to create adequate testosterone. So one, we have a decreased production of testosterone relative that we could just from that. Two, because we have so much adipose tissue, what testosterone we do produce gets parasitically lost through adipose tissue before it can make it to another area. Right. This is why people can have symptoms of low testosterone, and really it's a low estrogenic symptom, hot flashes, you name it, because even though their estrogen level can look normal or high on a serum, their brain's not getting enough because they don't have enough testosterone to make it there to satisfy the requirement.
Right.
Okay. So this is why we have to stop looking at serum estradiol as being like this. You got to treat it. You got to do this. You got to do that.
Right.
Now, if you're blasting 1,000 milligrams of testosterone a week, you can do whatever you want. We're really keeping this realm into TRT.
Yes.
Truth be told, I don't think you need to do anything then either, but more than likely you're not just using testosterone. You're probably using, 5 other compounds on top of it, which also can increase prolactin and cause a bunch of other issues. So
but that's where I think the gyno stuff comes from and carries over.
So since I know gyno was going to be the next question, that's kind of where I was sort of taking this. Okay. Gynecomastia. There's a paper on it. And if you read it, it does say that testosterone can happen from high testosterone. To date, I've never, ever, ever seen gynecomastia from high testosterone. But you know what I've seen it from? Low testosterone.
Mm-hmm.
Okay. Testosterone has an inhibitory effect for breast tissue creation, meaning if it is high enough in your bloodstream, it will block any breast tissue formation via the androgen receptor. Okay. And this is in this paper, and I'm just loosely paraphrasing from this paper. You need 4 hormones to make breast tissue. You need estradiol, you need IGF-1, which you will get from estradiol via growth hormone.
Right.
Okay. You need prolactin, and you need progesterone. You need those 4 hormones to form breast tissue. They also must go unopposed by testosterone. What do I mean by that? Well, let me illustrate this for a second. Okay. Let's take boys and girls, prepubertal. And we have a boy that's getting ready to hit puberty, and we have a girl that's getting ready to hit puberty. Females' testosterone levels change very little in puberty, and they're low to begin with, right? I'm going to say your average female testosterone level is going to be between like 20 and 50 nanograms per deciliter.
Mm-hmm.
Okay. Not going to be very high. Where your average prepubertal male testosterone level may be upper 200s or something like that. Still not very high. It may even be lower than that. But once they hit puberty, boy, that stuff skyrockets. And obviously, we've all been through puberty, so we know what it's like.
Mm-hmm.
Okay. But what happens when a female hits puberty? Well, their estradiol starts going up because they have ovaries that make it, right? Their IGF-1 goes up because estradiol goes way up. They have prolactin that goes up. That's partially in response to estradiol, partially in response to prolactin actually being manufactured. And then they also make progesterone as well. So all 4 of those hormones go up.
Right.
Okay. Does testosterone also go up? No.
Right.
Stays about the same. It does not reach an inhibitory threshold.
Mm-hmm.
And what do women make?
Breast.
Correct. In a male, what happens in puberty? Testosterone goes up first. Mm-hmm. Okay. Because testosterone goes up, estradiol in the tissue goes up. We do have growth hormone, or subsequently an IGF-1 from the estradiol. We get very little prolactin secretion and very little progesterone creation. Do guys develop breast tissue?
Not that I'm aware of.
Correct. So from that, we know that testosterone reaching a high level inhibits breast tissue, and it's that simple. Mm-hmm. If I give a guy that has low testosterone, he is not going to get breast tissue. Impossible.
Right.
Okay. There is a case, and there are some subsets of people that can get breast tissue, but it is generally because testosterone is low, and it is generally because they have a high propensity, as we talked about before, of adipose tissue and obesity.
Right.
And what that does is, 1, it alters their production of how much testosterone they can make, and 2, it lowers their serum values of testosterone by stealing it from circulation via body fat. And what does that do? It lowers my threshold from here to here, and it's not high enough to be inhibitory. And yes, those people can form breast tissue. There was a study done in the 2021, 2022, and it was, I read the whole study, and I don't have it off the top of my head, but I cite this a lot. Okay. It was about 260 male to female transitioners. Okay. So these were trans patients. Okay. They were men, biological men, trying to turn into women. The purpose of the study was to measure cup size over a year period.
Okay. That makes sense.
And that was the study, right? So they all had their testosterone production blocked by a GnRH agonist, meaning they were chemically castrated. Same drug I would give to somebody with like metastatic prostate cancer, Lupron, Firmagon, that type of stuff. Okay. Basically shuts the brain off from producing luteinizing hormone, essentially. And if we shut that off, you don't make testosterone.
Right.
It shuts off when we take testosterone, but we're giving it to ourselves too. So, but in this, we're not given that. And then they were given estradiol. Okay. So they were given an estradiol, either a pill. I don't know what they were given in there, but we have pills, shots, and creams. You can take either one of them. Okay. And they had estradiol given as a replacement. And So these were guys physically trying to grow breast tissue,
Right.
right? That was the intent. Over a 12-month period, of the 260 odd participants, only 3.6% of them grew breast tissue up to an A cup.
That's it.
That's it.
Hmm.
So even under the most perfect
Right.
conditions, it
I
still
mean, you're
doesn't happen.
literally trying to grow breasts.
Literally trying to grow it. And all tissue grew within the first 6 months. There was no new tissue growth beyond 6
Oh,
months
really? I wonder why that is.
because the hormone changes happened. It's settled in. It's also
Oh,
kind
so
of the
it's like
same reason
saturated
why.
in.
Well, right, because you got to think it's an estradiol in a male is not an endocrine hormone. It's
Right.
literally tissue specific. Okay. And this is why we see, like, for example, estrogenic changes when I give somebody testosterone, and I don't see those changes 6 months out because they're done.
Right.
We've now gotten them to a level of testosterone that they've lived at for quite some time. And estradiol will self-regulate itself given enough time.
Yeah.
Okay. This is why checking a level, treating a level is irrelevant.
Hmm.
You might have a period of time where you're sad.
Right.
That's fine. It's not going to be there forever. And it doesn't mean you should completely annihilate your estradiol,
Right.
because of it. That's really fucking stupid.
Yeah.
And then you're going to get ED, and then you're going to gain
Yep.
weight, and then you're going to get hot flashes. You're going to
Mhm.
turn yourself into a postmenopausal woman. And
Hmm.
even postmenopausal women don't want to be postmenopausal women.
No. No.
So, that's really what it's going to do. And it's not about just dropping it a little bit. When you give yourself an aromatase inhibitor, yeah, it drops what it shows up in your serum, but how do you think it gets in your serum? Right? We just talked about that. It's created where it's needed. So what happens is you just stop creating it in the places that need it. So your brain that had estradiol now doesn't,
Hmm.
right? Because you're not manufacturing any new estradiol. You've completely stopped its production for a period of time. So
So,
then
so
what's
Josh, hold
going to
on.
happen?
I'm gonna stop because I can hear people because I get the comments that are gonna say, but if I take a quarter of a pill or half of a pill,
Yeah.
it doesn't do as much as, a
The
whole pill
problem
or
is
whatever.
then is these people, the people that take AIs and say that you have to manage it, never get out of the cycle because they never let it go long enough to let it equalize.
Hmm.
Right? They crash it, right? Or they drop it, and then it comes back up, and they're going to go through that phase. They drop it
Drop it
again,
again.
and they never go through it because they're on a shitty protocol, and they didn't have a provider that could tell them that these things are going to happen, and you'll ride it out, and a few weeks later you won't have any of it.
Right. Right.
Because I'm not on an AI, you're not on an AI. The
Hmm.
hundreds of patients in my clinics, nobody's on an AI. We don't even check estradiol. Everybody's fine. I don't have any guys growing boobs. I don't
Hmm.
have any guys crying at Titanic anymore. I
Right.
don't have, anybody, complaining about nipple sensitivity or this, that, and the other.
Yeah.
Once we hit a threshold, that's
That's it.
done. These dudes are dialed in.
Yeah.
We don't have to
But
worry about any of that.
so I mean, I do want to where I do want to address gyno is real, right? I mean,
Can
there
happen.
are people that get gyno, but there's I mean, we've talked about this. I mean, you can go into it if you about the stages of life when that
Sure.
happens. It
And
just
it generally
seems
happens from areas of life where the testosterone cannot meet that
right,
inhibition threshold.
right.
Right? You can see it in the aging male, right? And I will preface too, we typically see this in people that have a high amount of body fat.
Right.
Okay. We don't see it in low body fat, at least in my experience. Okay. I have not seen it in a normal body fat individual
Hmm.
at all. Actually, I don't have anybody in my clinic that has gotten gyno from me starting them on testosterone.
Right.
They may have had it before they came in, but they didn't
Right.
get it from starting them on anything. And it
Right.
hasn't gotten worse.
Yes. So I mean, so the issues that people have, I mean, maybe sometimes it could be prolactin. Maybe is
It
that what
could be
that
because,
they're
well, you
thinking
got to
is?
understand, people like to take a lot of peptides, or they're using some of the other steroids. Some of the other
Mm,
steroids that people use are progestogenic, or they can create prolactin to rise. Some of the peptides that people use, like some of the growth hormone secretagogues, like hexarelin or GHRP, 4 or 6 or whatever the number there is, that can massively spike your prolactin.
mm.
Okay. So these are the things that, like, these aren't told, these kind of fly under the radar. Like, they're like, well, I'm on test, but they're not telling you they're taking, this other
Right.
thing, and
Right.
it flies under the radar. And it's like, okay, you're taking 10 things, but you're blaming it on one thing,
Right. Exactly. Yeah.
and it's unfortunately the wrong thing to blame it on.
Yeah. Yeah. No, I
So
mean, I mean, I know we talk about this, it seems like all the time, but
it does.
this is something for some reason that I think can always come up because I don't know if people start to, there's so much misinformation about it. That's the problem. I
It's
just
hard.
like literally t an hour ago had a conversation. Like I commented on somebody's post and somebody wrote on there that there was, and it was about an aromatase inhibitor. And the guy wrote, there's a whole like panel of professionals that would disagree with you. And I wrote, well, I'm like, that they should find a new profession.
Correct.
And he's
I
like,
mean,
well,
the
who are
thing
you to
is if
say? And I'm just like, all right, I'm not going to argue with you, dude. Like, I
right.
just,
I mean, I have an army of people in my clinic that can attest to this. And
right,
I actually can tell you uh, 5 other clinics that have an army of people in their clinic,
right.
you know, collectively
Yeah.
thousands
I
of
mean,
patients
you've heard
that
Viv, you've
are
heard
fine. Yeah, none of them
Dr.
use AIs.
Bronson, you've heard
None
all
of
of
them.
them.
Right.
Anastasia, you've heard all of them say, no,
No AI.
no AI.
Not necessary. Completely treating the wrong thing. They're treating a symptom that will go away in a couple days.
Yeah,
For what? Right? If you're a bodybuilder, right, and you're trying to get paid from it and you want to take an aromatase inhibitor to purge every little last ounce of water from your body before a show, have at it. I don't care
right,
what you do.
right.
But like in the terms of just guys trying to feel good on a daily basis, fucking horrible idea.
Yeah,
You
yeah.
know what I mean?
Yeah, I mean, it's just, I mean, it's the same thing, honestly, Josh, with enclomiphene. You're battling. It's the same thing. Like it's like we're
There's a lot of
pissing
people
into
out
the
there
wind.
that don't know. They just don't know. I mean, and here's the other thing. A lot of these clinics, they're not even owned by clinicians. They're owned by fucking, I don't know, somebody that sold cars yesterday. You know what I mean? And I made money in the auto industry, and now I own a men's health clinic
Right.
because it was the next hot thing to get in on.
Yeah.
Right. So their investment into that is purely financial motivated from the get
Right.
go. And I want to preface this too. I'm not harboring on anybody's hustle to try and make money through a business, but the idea of owning a business is obviously to make money. But then you also should have some other things kind of driving you behind it, right?
Correct.
What drove me behind this was, I wanted to be able to help guys in the capacity that I was not able to help them at from the urology group, because I realized the importance of it and how much it can impact not just that guy's life, but also his family's life as well.
Sure.
And
Sure.
that was really, so that was motivator number one. And motivator number two is I wanted to be my own boss. So
Yeah.
I don't like
Absolutely.
to take orders from other people. And I just didn't like the way healthcare was going. Right. I
Right.
mean, we see that, now. I mean,
Yeah.
there's so many, there's burnout is so high in medicine
Yeah.
right now because they keep wanting providers to do more with less. When was the last time your doctor's visit got extended, or is
Right.
now, oh, now you get more time?
Right.
Doesn't happen.
Never.
Hasn't will
Right.
never happen. It keeps getting shorter and shorter and shorter and shorter. And with
Yeah.
AI coming, it's gonna fucking get even
Get even
shorter than that.
worse. Yep.
That human connection, that rapport that you build,
Mm.
fucking kiss it goodbye.
Yeah.
Meanwhile, you come to a clinic like myself, I'll sit and chat with you for an hour, right?
Right.
Because I want to know everything about your life
Hmm.
and have a vested interest in how well you're doing in that life. I want to know if you're going hunting. I want to know if you got a deer. I want to know, if you're going on vacation next year and how excited you are
Yeah.
to get to that vacation, and that you want to lose 20 pounds before that.
Hmm.
And we're going to talk about that and develop some strategies that we can potentially hit that goal.
Yeah.
Right. And we're going to try and do it in the most cost effective manner too, because guess what? I got to pay bills just like you.
Yeah. Exactly. I
I
mean,
get
look,
it.
I have no, I mean, everyone has to earn a living, and I think you should. But also think that like you also, especially when you're in a business like this where you're like dealing with, there should be some kind of like moral code that you should be able to like carry
I
without being a
agree.
fucking scumbag, you know?
Right. And I think it's just good to live that way through life
Yeah,
in general.
exactly.
You know, like I have such a high level of integrity that like I just can't be like that scummy douchebaggy type person.
Yeah.
Like I can't swindle somebody out of money for my own gain because I
Right.
got to live with it.
Yeah,
And I don't want to
exactly.
live with that, right?
Yep.
Because I wouldn't want it done to me.
Yeah.
So, and if I don't want it done to me, I'm sure as fuck not going to do it to
Yeah.
the next guy. You know what
I
I
don't
mean?
think I don't even know if I've ever tried it, but I just don't think I would because I wouldn't believe it. And because like my wife always says like she can tell when I'm lying. It's because I don't believe it. So
Right.
when I'm talking and like she just knows like no, your mannerisms or something's not off, that you're not
Right.
telling the truth. You know what I mean? And then I'm like, all right, well, I did buy 6 tins. Sorry. It's like,
But yeah, I think it's good. And I think people really appreciate the authenticity that you bring by having a high level of integrity,
yeah,
right?
for
You'll
sure.
lose out on stuff for
Oh,
sure,
for
right?
sure, a
You're
hundred
going to lose
percent.
out on everything. But at the end of the day, does it really matter?
Right.
It doesn't. You know, I'd much rather live on morals and principles and die on that hill
Yep.
than, you know, be Scrooge McDuck swimming in a
Quick
pile of
money is
gold.
short money, dude.
Quick money is short money.
Yep.
And I'm not in this for the short money. I'm in it for the right reasons, you
Yep.
know. And we're trying to do this the way that I think it should be done, that
Hmm.
nobody else is doing it that way, or very few people are doing it
Right.
that way.
Right.
So, um, because I think it's the right way, we need to get back to connecting with people again.
Sure.
And I think it goes a long way. Building trust, right? And I have patients that come to me and they're like, listen, I will do whatever you tell me to do because so far everything you've told me has been
Yeah.
100% on the spot.
Yeah.
And I'm like, listen, like, I'm not going to have you walk a path I wouldn't walk myself.
Hmm.
So, and that's how I
Yeah.
come
I
to
mean,
patients.
that's something that that I think that's something that's overlooked in a lot of things where it's like, you know, people don't. I mean, I'm in the construction business where I mean, notoriously there's most contractors are fucking thieving scumbags that'll steal your money. They just, you know, how many times have you heard a story? I gave the guy 20% down or 50% down, and the guy just walked away. I
Happened to my
mean,
parents just this past year.
I've heard that story a
Yep.
million times. Makes it harder for me to get money down, but you know, you almost want to do the thing like what like with you. It's like, hey, give me 6 weeks, and then like we'll talk then. You know what
Right.
I mean? And that's where like I do the same thing. I'm like, hey, let us get like a couple days in and then we'll talk like you know and see like how we
Yep.
show up every day, how we clean up, how we do things, like how we're not just there ripping cigs in your living room and like you know not giving a shit, like we actually
Right.
care. You know what I mean? It's not like the other guys, we're you know different. So I think that goes a little bit, and then they tell the neighbor, you know what I mean,
Yep.
that you know this guy does this and this you know this is what they did different, you know, and I think the same thing goes in your business as well. It's like,
Yeah.
hey man, I went to Josh, and then it's like now they're going to say, whatever you say, dude, I'm doing it because this
Right.
works, and then they tell the next guy and the next guy. The thing is that it takes longer that way to build a business and build a
It
following.
does. Yep.
It takes longer, but
It's
you
more
get
meaningful.
correct. You get more meaningful, more loyal, more
Yep.
people dug in. You know what I mean? You're building like an army that way.
Yep.
You know, the only thing that sucks is that it takes a long time.
Yeah,
That's
it does.
like,
It does.
that's the thing
You know
that
what?
sucks.
It's okay. It's you know, I don't want to blow up overnight essentially.
Right. Exactly.
I'm happy with the organic growth, but you know, I do stuff even above and beyond. Like I actually take some of my clients golfing and I pay for
Mm,
it. You
nice.
know, I go, I'm like, let's go, you know, and I do this periodically and I'll, you know, I have got some guys that are into golfing and or guys that are not, we're talking about it. And I'd be like, hey, you want to go golfing this Sunday? And they're like, yeah. I'm like, I'll call you, meet me here at this golf course at this time. Everything's covered. Bring your clubs. Let's have a good
Nice.
time. And I've done that a couple times. And it's something in 2026 we're going to continue to do. Obviously, the telehealth guys apologize that you can't join us on this.
Yeah.
Going to try and think of some ways we can kind of do some things for the telehealth guys. But I like, you know, one of my tenets of like what we preach and what we talk about in our consult is like activity, getting more active, becoming
Hmm.
more active. Yes, I want you in the gym at some point, but like sometimes we got to take baby steps. And maybe that's just getting you out of the house and getting you on the golf course and
Yeah.
watching you shoot a terrible round. But that's fine
Yeah.
because you're not at home sitting on your ass.
Right.
Right.
Exactly. That's exactly it.
And golf's hard and it's fun because it's hard. Right. I have no illusions that I will be, in the PGA Tour anytime soon. But
Hmm.
I do have some personal goals for myself with golf, and like anything, you have to practice at it to get better, and
Right.
that makes you, a better person. It helps build discipline,
Hmm.
and that's what. But I like to do. I like to give back to my clients. We're going to have some things in 2026. We have a big 130-inch screen in our office. We're going to do a catered fight night where we get a big UFC fight on the screen. Everybody comes out. We're gonna have some football nights.
What is
We're gonna have.
isn't the UFC doing a fight at the White House?
I've heard that.
I
Yeah, I've
think,
heard they're trying to
I
get that
don't
set
know
up.
when that is, but it's like on the lawn of the White House,
Yep,
which
that's
is
going to be
fucking
huge.
crazy. Like on the lawn, dude, Trump is out of his
It's
fucking
it
mind,
it's
dude.
it's in. It's going to be on June 14th,
So it's
2026.
this June, okay,
This June. So,
on
well,
the
you know what you
lawn of
need
the
to
White House.
do? You need to come in. We'll watch it on the big screen.
Yeah,
We'll do a
absolutely.
party at
R-
Veered Self
Right.
Optimization. Maybe
What
we'll
a
get that set up.
fucking madman. Who was it? Trump that wanted to do that? Probably.
Well,
He's
he's
out of his
friends with
fucking
Dana
mind.
White,
Yeah,
so
yeah. Him and Dana
yeah.
are real close.
So we talked about estrogen. We talked about gyno. I
Oh,
also
yeah.
talk about androgenic alopecia, okay,
Oh, right.
which is hair loss. I guess we could talk about that because that question comes up
That
too.
comes up all the time.
Okay. Or am I going to lose my hair when you go on testosterone? If you are losing hair or prone to losing hair, you're going to lose it even if you don't go on testosterone.
Hmm.
Hair loss is genetic.
Yep.
So it's either going to happen or it's not.
Yep.
Can you try and keep it? Sure. There's
Yeah.
options out there that exist. One of the more controversial options is the 5-alpha reductase inhibitors like finasteride or dutasteride.
Hmm.
I'm not a fan of blocking DHT, much how I'm not a fan of blocking estradiol. We definitely need DHT for very specific roles in our body, and DHT is created just like estradiol, tissue specific. Okay. So again, measuring serum DHT levels, not accurate.
Yeah.
Okay. Um, I don't like to block it because we need DHT and but there is something to say. Post finasteride syndrome is a real thing, and that's erectile dysfunction that is dang near irreversible from the use of a 5-alpha reductase inhibitor. It has about a 2% risk ish. Okay. Okay, it's low, but it's still 2%.
Yeah.
Okay.
Yes.
So does that mean that we really want to potentially flirt with disaster or risk it? And I think this is where we get into that, with somebody that's like, I want to keep my hair, I want to do that. If it's incredibly important for you, we're going to try to do methods to keep your hair without a 5-alpha reductase inhibitor.
Right.
Okay. If that is our last resort to try to save, because it's so important to you to keep it because you're losing it at like a slower pace, it's not rapid or whatever, and you want to keep it, that's a discussion that we would have. But ultimately, we would talk about here's the risks,
Yeah.
here's potentially the benefits. Is it worth it for you to do that? But I can't make that decision. Only they can. But
Yeah.
that's a discussion we have. And yes, you're going to say, what about topicals, right? They don't technically go. Topicals still absorb into the
Hmm.
bloodstream the same way an oral medication will get in there. So it can, even though it's supposed to just work on the scalp, you do get some levels of 5-alpha reductase that does travel that way. So it's better than the oral version of it,
Yeah.
but it still carries,
You know
a
what, dude?
risk with it.
Don't fight genetics. Don't even risk anything. Shave your fucking head,
Just
get jacked, and just
yeah.
live with
The
it.
other option, and I will throw this out here, shameless plug, is I know we do P shots, right?
Oh, yeah.
The other option is we can do PRP hair restoration, which I also perform.
Hmm.
Okay. And basically what we do is we just take the areas of thinning in your body, okay, or on your scalp, and we would kind of paint that out, and then we would inject small little amounts of your own platelet-rich plasma in those areas.
Right.
Okay. And you have to have a series of them so you don't just do one and done. I'm currently working on content for that. So hang tight. We just did one the other day, took some pictures, obviously left out some identifiers. It's literally just a crown of a head, right?
Hmm.
So you can't see anything, but then we're going to take some pictures as we progress with these over and over and over. I guess we can see how well it actually works.
You know what's weird, Josh, is that obviously my genetics, I lost my hair before I was even
Sure.
started TRT. But when I started TRT, I noticed, like, I don't know, a couple months in, that like my beard
Yes.
it grows like faster and thicker,
Yes.
and
You're
then
gonna
like my
grow
back hair, like
back
and my
hair.
hair
Yep.
everywhere grows, but my fucking head it doesn't do
Yeah.
anything. It's like
Back
what
hair
the
and body
fuck,
hair, or
you know?
body hair and facial hair grow a lot faster on
Right.
TRT. Like if you want to get a beard, that's a real fucking easy
But
way
like,
to
how
get
is
a
it the
beard.
hair can grow here, but like 9 inches away,
Right.
nothing?
Yeah.
Fucking
I don't know
weird.
if it's I don't know if it's because the DHT on your
Mm-hmm.
the area on your scalp is not the same as that on your
Yeah,
face.
yeah. It's got to be
So,
something along those lines.
right.
Um,
Right.
but I've been shaving my head for so long now that I don't even remember what it was like.
Right.
And it's spectacular, dude. I know
I
people like
think
hate it, but it is
no,
spectacular.
I think certain guys, and I don't know what it is. They just have a shape of their head
Yeah,
that they just look better bald,
right.
right? Men's Health magazine actually did I think it was Men's Health. This was years ago, and they surveyed I think 100 women of would you prefer a guy that had hair, balding, or bald?
Yeah.
And obviously hair got the most,
Yes.
okay? But then the balding guys got like zero. Like the women were basically like, listen, if you're balding, just
Just
fucking
shave it.
just shave it. And I'd
Right.
rather date a bald guy
Yeah.
than a guy that looks like he doesn't have any
Hmm.
hair. You know what I mean?
Yeah.
Because it's like at that point, you know, you're
Yeah.
just kind of waiting out the inevitable.
Yeah. No, I mean that's definitely. Um, I, I I I was lucky in the fact that like I mean I just did it. I have a perfectly round head too, so
Yeah,
it,
you've
it
got a good
works
shape.
out. Right, it
Right.
works out. But I do see people that happen. I'm just like, ah, that sucks, you
Yeah.
know. Um, but yeah, I mean, I was never like I know a lot of guys that I mean I actually know people that are friends of mine that have been fighting it and just like won't shave their head and it's
Yeah.
just like and it's they have I mean they have real issues from it, like psychological issues from it, you know what I mean?
Yeah.
And I'm just like, dude, just shave it, but they're like, no, no,
Embrace the bald.
yeah, I mean, just do it, dude. I tell
Right.
you, man, like I don't know, I love it. When you get in the shower, dude, that shit is like jump in a
Easy.
pool. Yeah, I shave it just in the shower, quick, man, done.
Done.
So I don't
Yeah,
know.
I think you look good.
But yeah,
So,
but that is a question that people have.
yep.
Another one, Josh, since we're like going along, is if I'm going to play the part again, I'm going to go back and say,
Sure.
I'm concerned about acne.
Oh, that's just gonna happen.
Right. That's why I tell people, I'm
Yeah.
like, I
Yeah.
just told a guy the other day that wrote something. I was like, he goes, I have like terrible acne from testosterone. And I was like, I wrote back, my first question was, did you have it when you were younger? Like
Yeah.
when you were going through puberty? And he was like, yeah, it was terrible. I was like, yeah. I was like,
Yeah.
that's just
So there
unfortunate.
is a time, I mean, getting, the occasional, zit here and there, get them on your back, that's one thing. It can be problematic in individuals where they develop cystic acne, which
Yeah.
is like that,
Right.
real bad nodular acne. At that point, we have to look more into just then, salicylic acid, the stuff that we've talked about before. At that point, we're going to probably look into a topical and or oral antibiotic. Okay. And uh, at very last resort, we may even microdose isotretinoin.
Mm.
Okay.
I
That's
just
always
saw one the
last.
other. I should have sent it to you, a video of a guy. It was terrible, man.
Mhm.
His chest, it was like,
Yeah.
oh, it just looked painful. It just
I
looked
have
fucking painful.
I have one guy that has really bad cystic acne and he's on like just a normal dose. And I feel bad for him because it's like literally in a strip right below his nipple line. Like a
Oh,
fucking
really?
it's like a strip. It's weird.
That's bizarre.
It's really bizarre. It's really bizarre. It might just be how his skin formed when he was a kid. I don't know.
Yeah.
Because it's literally just right there.
So that's
Okay.
it. It's not like anywhere else. It's just
Nope. It's
there.
just a strip,
How the
but
hell
it's
does
just
that
like
work?
all this acne there. So we've tried everything and we're currently on isotretinoin for him to see. And it's gotten better. It has.
Uh,
We're gonna have to run that for about a year, I think, because we're not doing like the full dose, we're doing a microdose, so it's a lot less. It takes longer, but it's a lot easier on the liver and all that other
yeah.
stuff too. So
How
yeah.
long can you take? Can you take that for like X amount of time, or do you have to? cycle?
Isotretinoin? No, like once your acne stops on that, you won't get it
Oh,
back.
you'd stop. Okay.
Yeah, you're good. So you just have
Oh,
to get it
oh
until we
shit.
get it under control, and then off you go.
Then you're good. Huh.
Yep.
That's weird that it grows right like it
Vitamin
appears
A
there.
derivative. Yeah, for him, that's where it is. So, and I've had good results with oral doxycycline too, because it kills the bacteria that get into the sebum that
Mm,
creates, skin eruptions. So yeah, that can help too for certain individuals. We did that for that guy. It didn't help at all. So then we were like, okay, we have
mhm.
to move to the next step. And, obviously he's gaining a lot of benefits from TRT. We want to keep those benefits. We're not going to
Sure.
let this acne be a deterrent. We're just going to try and treat it. But it's rare to be that bad. It doesn't
Yeah.
happen that bad, but it can. Okay.
Yeah.
So acne, we do talk about that too, briefly. The last thing I talk about before we end, before I ask if anybody has any questions, and we go over kind of like a timeline. And I know we have a timeline episode, so I won't get into that.
Hmm.
But the last thing I talk about is prostate cancer and cardiovascular risk, because I know those are two questions. You're going to get a blood clot. You're going to have a heart attack. You're going to have a
Sure.
stroke. You're going to get prostate cancer. None
Hmm.
of which is true. But um, so the first thing I dispel is prostate cancer. Obviously, we had I think we talked about prostate cancer in a prior episode. Um, I know we talked about BPH,
Yeah.
but um, you're not going to get prostate cancer from testosterone. Medium Gleason cancers, like intermediate risk cancers, can unfavorably respond to higher testosterone thresholds than obviously having no testosterone. It doesn't mean that we're going to castrate somebody with
Right.
localized prostate cancer. The only time I would treat uh, prostate cancer with like castration, so to speak, or what we call Lupron or Firmagon, a GnRH agonist or antagonist, basically turning your brain off, is if it was metastatic.
Mm.
Okay. Metastatic cancer is cancer that's no longer organ confined, it's somewhere else in your body.
Yeah.
Metastatic prostate cancer is not curable. Okay.
Mm.
Eventually, you will die from the metastatic prostate cancer. Okay. Once it travels somewhere else, it's somewhere else in your body. There's really no way to treat it yet. Okay.
Right.
There's ways to manage it. Okay. When I mean manage, to kind of keep it suppressed enough for a period of time to where it's not going to go anywhere else or create a problem. But eventually those options don't
Yeah.
work anymore. And then it will go from one place to another, to another, to
Mm.
another. So it can be managed for a while actually, but eventually it's gonna,
It's inevitable.
and surprisingly we can keep quality of life kind of high. But testosterone by itself does not cause prostate cancer.
Hey, Josh, where did that come from? Is there like a study? Was there something?
Hodges and Huggins in 1943 had a whole whopping
Mm.
one person that
Mm.
they gave. I believe that guy had prostate cancer. They gave him testosterone and noted that his disease proliferated very rapidly. Okay. So then they made the correlation that testosterone does affect prostate cancer cells. That kind of stuck around for a while. And I think it's just been sort of like this old wives' tale that it causes cancer.
Right.
It never caused it. If testosterone caused prostate cancer, every man in existence would have prostate cancer because we all have it. It's in our body normally,
Right.
right? So it doesn't cause prostate cancer. Okay. It can. And I think this is what Hodges and Huggins basically saw, was that it made it worse, right?
So
And a
if you
person that already have it.
right. So if you have it and then you take testosterone, it will.
It can make the cells grow faster. This is
Right.
why we don't
Which
give
makes
it in
sense. That makes
metastatic
sense.
disease, right?
Right.
Because it creates it's basically fuel for those cancer cells. It's the same thing for HER positive breast cancer, right? Estrogen receptor positive breast cancer. They don't want women with estrogen receptor positive breast cancer to get estrogen,
Right.
right? Why? Because it could potentially make it
Right.
worse.
Yes.
So they don't do that. So they refrain from having estradiol and those
Mm.
particular. They can use vaginal estrogen in those people because vaginal estrogen for atrophic vaginitis is helpful for recurrent urinary tract infections, and it's really good for like lubrication. So if a woman is menopausal and doesn't have any estradiol
Yeah.
anymore, some oncologists, we just had a patient that her oncologist, she had a history of estrogen receptor positive breast cancer, didn't even want her taking testosterone.
Oh, no shit.
Yeah. Why do you think?
It'll raise her estrogen.
Correct. Women are going to aromatize
Yeah.
testosterone, estrogen, just like men do.
Hmm.
Okay. So that was, she was, she had had a history of it. I think it was probably pretty low risk in my professional opinion, but these are discussions that we would have with clients, and she
Yeah.
just decided that she didn't want to pursue it because of the fear that's
Yeah.
there because of that. So I think she would have been fine, but nevertheless, these are things that were, you got one thing saying one thing saying
Yeah.
another. Who am I
Right.
going to believe?
It's
They're going
easy
to
for you
believe,
and I to say that. But if
right?
you're,
But I mean, who are you going to believe? You're going to believe the person that's been in oncology for 30 years. You're going to believe this guy that has a clinic.
right,
Even though
right.
I can read the same literature and
Yeah.
disseminate it the same way they can.
Well, that's what I'm saying, Jess. There's a lot of like, just if you go on Chat GPT and there's a lot of just like misinformation,
There is.
just out there that, because we all think that Chat GPT thinks for itself. It just doesn't. It just
No,
collects everything that's out there and just spits it to you quickly.
right. It's
So
an
if
LLM.
it's
So
right, if it's taking information that's not correct, it's just giving you incorrect
incorrect
information quickly.
information.
It's
Yep.
like, that's all that it's doing.
Right.
So those things are still out there, and if like because there's times I'll type or talk in the Chat GPT and say something, and then I can get them to, because I showed my daughter the other day how I could get Chat GPT to contradict itself,
Oh yeah.
and it's
Um,
super simple to do because
I just listened to that Joe Rogan podcast with John Kiriakou. If you haven't listened to it, listen to it. Phenomenal episode.
he,
So good. That was the
he
guy
was
that
the
got put in prison.
CIA guy,
CIA
right?
whistleblower
Okay,
that got put in prison.
yeah.
Dude, listen to that episode.
Didn't
It's
he? Oh, he was the whistleblower because they were like torturing people, right?
correct. Yeah.
I
Dude,
remember
it's
that.
so good. It
Yeah,
is an awesome episode. You can always tell a good episode because if Joe's not talking, that means the
yeah,
story is really good because he's
right.
just he's just listening,
Yeah, they did some
right?
sick shit to people. I remember when all that shit was going down.
Right. So, but he actually John Kiriakou's talking in that, and he's like, yeah, I put my who is John Kiriakou into Chat GPT, and it's like it spit out that he went to this school that he never went to. He had a degree that he never
Oh, no
had.
shit.
So then on the show, they went into another AI engine, which is what Perplexity, I think, is what they used,
Oh,
and they
yeah.
put it in, and the information was correct in that AI.
Oh,
So now we're starting to see, you
differences
know,
in the
right,
artificial
like
intelligence.
what's true, what's not. Now we don't even really know because now you have two things
Yeah,
literally you know
right.
kind of going against each other.
And
So
that's the problem. So people type in, you know, and I get it. You know what I mean? They ask questions. It's like, well, we've
right.
said this 20 times, but you type into your phone, you think ChatGPT knows, and it tells you, well, TRT causes strokes and heart attacks.
Yep.
So then they reach out to me and they're like, well, what do you know? I'm like, well, I don't know, but
Well, I
but
mean, it doesn't because the FDA removed the
right,
cardiovascular warning from testosterone. Now, I want to preface this with a big asterisk, okay? Because I have beef with the Traverse study,
right.
which is what they used. And we'll talk about this, and I think this will pretty much wrap it up because that this is basically the end of my consult, aside from just like some small things. But
Hmm.
I talk about the Traverse study, and my beef with it is the inclusion criteria was good. All guys included in the study had to have testosterone values below 250. So that's good. We can all agree that
Right.
if your testosterone is below 250, it's low.
Hmm.
Okay. So just to be in the study, that had to be present. So everybody was 250 or lower. Okay. They were split into two groups. There was a placebo gel group and there was an androgel group. In the actual experimental group, the people that were getting the testosterone, not the control. Okay. The total testosterone values that they got guys to be in were between 350 and 750, which we
From
also, with knowing what SHBG and free T, we don't even know. If somebody had an SHBG of like, let's say 80,
right.
okay, which could very much be the case because we're dealing with the older population. Older men have higher SHBG values,
Hmm.
okay? and they have a 250 or let's say 220 SHBG, and you just whiff testosterone at this person, it's going to make their total value look super high, but their
Skyrocket. Yeah.
free T is still going to suck.
Right.
Okay. They could have a 750 testosterone value off of a low dose of androgel, but it doesn't mean that their free T moves a whole lot either. Okay. We don't know what happened in that regard in the Traverse study. All I know is we got total values between here and here. Okay.
So that's all they checked was the total
Pretty
testosterone.
pretty sure. I'd have to go read it again.
Yeah.
But I know that one gets brought up. Okay. At any rate, even if they did measure free, it's not like 750 is all that high. Right.
Yeah.
I mean, I'm starting guys on testosterone with 700, totals, depending on what their free is and everything. At any rate, that's my kind of asterisk. So what they did was they went 4 years and they kept this going. And they basically said, okay, who's having heart attacks, strokes, blood clots, acute coronary syndrome, you name it, in the experimental group, and who's having them in the control group. And what they found was it was about the same in both groups, meaning that the guys that got testosterone, they still had heart attacks or strokes. Like it didn't mean that they didn't. It's just they didn't have them any more than the other group did.
Right.
It was basically your general population. This is what's going to happen.
Right.
Okay. So they concluded from that says, listen, after a 4-year time frame of putting people on testosterone and keeping their levels between X and X, there was no increased risk of cardiovascular disease, heart attack, stroke. Okay. That's what prompted the FDA to remove that cardiovascular warning. Now, let's go to how we do it at our clinic. I'm not getting your 250 to 750. We're probably going to bump it a lot higher. Matter of fact, I don't even care what your total is at all. I'm more looking at your, one, how do you feel? Two, your free T. Okay. We in general run much higher values than what they had in that study. So I cannot say for certain that running a higher free T value carries the same risk of running what they did in that study.
Right.
Do you know what I mean? So, because we're literally doing it almost like two different ways.
Right.
Okay?
Exactly.
So I bring that up. But the caveat of this, there's two things. One, there is a plethora of data that shows that low testosterone significantly increases your risk for cardiovascular disease. Okay. That is not even debatable. There's literally half dozen or more studies out there that show that. Easy. You can find them in 2 seconds. Okay. So we know that. Two, what you gain from having a healthy free T with lifestyle changes, increased muscle mass, decreased visceral fat, better cholesterol metrics, better blood pressure, right? All of these things are shown to decrease your all-cause mortality.
Right.
Right. So if getting you at a higher level and more active and more energetic and more metabolically stable, I think the risks of potentially anything going wrong
go down.
Don't even come close to the benefits that you're going to have.
Right.
And the reduction of all-cause mortality from all of those other things. I don't even think it sheds a light on it. I think the benefits dramatically outweigh the risks.
Yeah.
And that's what we talk about. And I think every guy that's on it completely agrees too.
Sure. 100%.
Yep.
I don't think anyone would.
Right. And when you see what's possible, I mean, sure, we're going to be higher. And here's the other thing, and I'll bring this up as sort of like another caveat. I don't have relative testosterone numbers reliable beyond the 70s. I don't know what a guy's testosterone value was in the year 1900. 1500 could have been normal back then.
Yeah.
We just don't know, right? We do know from the 70s up until now, we have seen a decline in testosterone values decade after decade after decade after decade. So does that mean if we followed that same decline and went backwards, that we would have gone up in the same amount? I don't know. Nobody knows.
Maybe, man. And when you look at like the way we used to do things, it took a lot of balls.
You got to think. I mean, look at what people ate. Okay. Right. Look at the jobs that people had. Everything was physical, right? I mean, when you go back, let's go to the 1800s, even back by then. I mean, how did you feed yourself?
Yeah, exactly.
You know what I mean? Like, did you go to work and get money to come
Right.
buy groceries at the market and come home?
Hmm.
It's usually bartering of services,
Yeah.
or, there was a kind of a collective community whole where, like, you did this or you did some odd job and maybe got some money for this or whatever. But that's how you had to, get your food.
Yeah.
You
Then
had
you
to
got in a
work.
confrontation with somebody, you go out in the street and fucking shoot at each other. Like, I mean, that's what I'm saying.
I feel like
These
that
guys,
happens nowadays too,
well, yeah, I guess that's a
but
little different
but
though, because
but less than formality, more
yeah, I think each party in those times were willing to go out and do it.
right,
This
right.
was yeah, now it's a
Take off their
little bit
glove and
different.
slap you in the face with it.
Right. It's exactly
I
it.
challenge you to a
But
duel,
like think
sir.
about like like charging on horseback with a fucking sword
Mhm.
to like you know what I mean? Like you
Yeah.
that's we may have to how would they be able to tell with that? Would we be able to
I don't know,
check?
but we just don't have the data to go back that far, so we don't know, right? I mean, we say that 1500's high nowadays. It could have been completely normal 100 years
Probably
ago,
was, yeah.
right? We just have no idea, right?
Vikings
I
probably
don't
had
think
fuck tons of
I
testosterone.
don't think 5,000 was ever normal, but I don't think, when we're starting to crest, you know, 20-30% over the normal value of what
Right.
we think, I think that's probably relatively okay within the margin of error of what could realistically possibly been, have happened in the past.
Yeah. For
So,
sure.
so we finish up on that. Okay, with that kind of the cardiovascular risk, ACS risk, yada yada yada, the risk benefits, the pros and the cons of all that, and then we finish up on kind of like a timeline. We talk about obviously some of the side effects, water retention,
Hmm.
breast tenderness, moodiness, and
Okay.
that,
Water retention that will go away. I know everyone gets freaked out about
yeah,
it. Just
don't
give it
weigh
time.
yourself, just let it
Give it
go.
time.
Yep, it does not last. Doesn't last in anybody, but it happens to everybody.
Hmm.
Just all the common things that are going to happen over time. I've had a lot of people, not a lot, but more disproportionate recently, people messaging in about getting hot or like hot flashes. And that can happen when there's an abrupt change in your HPT axis.
Mm.
Okay. When you go from low to high with testosterone, it can cause those changes. So again, temporary, doesn't last.
Mm.
Okay.
All right.
So
Well, I enjoyed the consultation. I'm probably just
yeah.
going to take clomifene because that seems to be easy. I just got to take a pill, and then my buddy took it, and his test was up to 1100.
Yeah. Ask him if
So,
his body fat moved at all.
oh, we didn't check that. We didn't check that. We didn't check SHBG. We didn't check free D. We didn't check anything else. Just on paper, we went from 250 to now 1100.
Yeah.
So
I
obviously,
we do body scans on everybody in our clinic since I got
mm,
that machine, and it has been awesome to see some
yeah.
changes.
Oh, I
I had
can
a guy
imagine.
a guy come in today, he's lost 16 pounds in 2.5 months.
Josh, you know what we would, I mean, I would hate to do that to somebody, but what if you could do that? Give someone enclomiphene, someone that wants to take enclomiphene could come in, get a body scan, right? And
Mhm.
somebody can take testosterone that, the way, like start them at the same time,
Yeah.
get a body scan, then they can come back, body scan,
Well, hey, if
and you can
anybody's
show.
listening and you're on enclomiphene, go get a body scan and then stay on it for another 6 months and get another body scan and then
Yeah,
send us the
see what it
results.
does. But my
So
test on paper, it
test on
goes up.
paper,
That's what they keep saying.
more than
My
just
total goes
testosterone.
up. It's just like,
They're
yeah, but
they're
there's
literally
more to this.
literally chasing one goal and not looking at the whole picture.
Yeah. And honestly, missing out on the biggest part of the pictures.
Yep,
You know what I mean?
100%.
Like that picture is, you're looking at like the corner. There's a
Yep.
whole rest of it that is that,
Don't shortchange yourself, man. Just because it's
yeah.
easy doesn't mean, and we preach this everything. Nothing worth doing is easy.
Yeah. A
It's
lot of
always
people get
hard.
caught up in, dude, there's two things that people get caught up in, Josh, the total and the amount.
Yep.
Like guys, it's like a fucking ego thing with
It
200
is.
megs a week, man.
Don't even care.
They're just fucking like, oh, I'm taking two. And I'm like, dude, you may not need that. You
Don't
you
need it.
may just back down. Like, no, I need it. I'm like, okay. But then it's like, well, I have this issue and that issue. I'm like, well, it's like,
Yep.
it's like, I don't want to tell you what to do, but maybe you could back it down. No, I'm not backing down. Okay.
Okay.
But that's for some reason, there's a lot of guys, I don't know what it is, that are stuck at that number.
People
They,
act like you can't add, muscle with just testosterone, like normal values. I've
yeah.
added 30 pounds of muscle in literally 1 year.
Right.
I will show you one of these episodes. I'm going to get on and I will pull up my first ever body scan I had
Yeah.
done in August of 2024 when I first started working out. And I will pull up the one I just did in July. I'm getting ready to do another one here. I've been kind of waiting, but I'll pull up my one on July 14th that I
Yeah.
did. And I will show you how much change happened in that amount of time off of testosterone, 150. There was about 6 weeks I was at 180 very early on, back in November of last year. It was almost a year ago. Went back to 150. Been on HTG the whole time, and I did take CJC for about
Right.
5 months in the middle of that.
Mm-hmm.
Okay. But I will tell you, I have a scan. I did a body scan every month from August until January. I did my last scan on January 31st. And I will tell you, the majority of my gains happened after January 31st. I finished CJC and ipamorelin in March, which also coincided with my 1 year anniversary of testosterone. And from March onward, I blew up.
Nice.
That's when most of my gains happened with just testosterone at that point.
Right.
I tend to notice that 1 year mark is when things really get turned up for a lot of people.
Yep. Yeah. That's what mine was too. I think once I got to probably like 10 months, I could tell like I was like peaked. I was like, you know,
Yep.
because like each month you could tell something was a little different. Like your libido was, or your gym or your energy, like something was getting a little better, just incrementally, but you could tell just a little bit. And then I think right around 10, 11 months, I realized, you know what? I don't have any more energy. I think this is it. Like I'm capped
Right.
out, and, you know, and that was around a year, you know, and it's been
Makes
just
sense.
running ever since.
Makes sense.
So, all right. Well, I guess that's good. I got to go help with homework.
Sounds good, man.
You are going to be off next week.
Yes.
Do you have any other news, like maybe new states?
Oh, yeah. I guess I should probably bring that
Yeah,
up.
that was a good idea to bring that up.
I'm leaving for vacation next week. So if you're listening, we'll probably be taking a week off. I am adding New Jersey and New York because we've had a lot of reach out for those particular states, and they're also next to the states we treat. We are booking for patients in those states right now because of me going on vacation. We also have something planned in November, which we'll probably talk about in the future.
Yep.
Okay. And I'm going to be away for a little while for that. And so I'm currently out to December with new patient bookings just because with the time off, it's condensed all my other patients with the new patients. And I don't really have a lot of availability because of this time. But if you are in New York and New Jersey and you want to be a patient of our clinic, fill out a contact form or give us a call. Okay. You can speak to Ashley or Trish. We do have a new front staff member. Her name's Trish. She's wonderful. She's learning. Go easy on her. But Ashley's always going to be there too. She's learning from Ashley. She's doing a wonderful job. And we're going to be adding New York and New Jersey. So we will have that. And we'll be ready to rock and roll. We're already ready to rock and roll, but for anybody, you know, now we're putting that announcement out there. Yep. Probably we'll be able to get everything, blood work, get your appointment lined up, get everything ready to rip and roll for December. So
nice. Good.
And then in 2026, we might even have some more news, probably say fairly early on too. So just stay tuned on that one. Okay. But I think that one's going to be really big.
So take care of the guys from South Jersey. South Jersey's basically Eastern Pennsylvania. Yeah. A lot of Eagles fans, Phillies guys. That's our area. From mid Jersey up, they're the Giants, Jets. You can charge them double.
All right. I'll be sure to say that. Yeah. Where do you live in Jersey?
Yeah. So you're a Giants fan? That's double the price. Yeah. Oh, you're a Birds fan? No, you're good.
Yeah.
So, all right. Well, that'll be exciting. Other news coming up will be exciting too. November, we will be away. What is it? The middle of November, right? It's like
middle of November. Days. I guess we should say that we are away.
Yes.
At the same place.
Yes.
So
November 13th, I think it starts. Is it the 13th? 13th. Yeah. We'll talk about that.
Yeah.
I don't know if people are we're going to do stuff from there too.
We are.
So it'll be fun.
Maybe we should do a TikTok live from down there. I haven't done one of those in a while.
Yeah. Well, there'll also be other. Well, yeah, yeah,
Yeah,
yeah.
we could probably get like a
Yes,
host of people.
that's what I'm saying. There'll be a lot of people.
I
So,
think it'll be interesting. I think we'd be able to
yeah,
get some people in on that one.
yeah. All right.
So
Well, we'll keep them guessing for another week. I think I might
yeah.
actually have my wife next week and talk about her because she is now what, 9 months? 10? No, 10 months.
Mhm.
No, 10. What? This is October, right?
Yeah.
So she's at 11 months
Yeah, almost
into
a year.
almost a year
Yeah.
into HRT.
And
So
you let me ask you this too. Don't answer it just for next week.
yeah.
I think how you doing on that new peptide?
Oh, good.
Yeah.
I love it. The pump is tremendous.
Is it?
The other thing I want to say, real quick, Josh, 120 is too low for me.
I kind of figured it would be.
Yeah, I can already tell I'm on like
I
two
kind of
weeks
figured
in.
there's a sweet spot for everybody. I think yours
Yeah,
is around
120. I
150.
did it, and like this is week two, and I can tell.
Can tell.
I can
Yeah,
tell that
might
it's
want to
too
go
low.
back up.
So I'm
So,
thinking I'm going to start. I'm going to finish out this week,
uh,
and then I'm going to start. I'm going to try to split the difference. So it'll be like 135.
okay, give it a
In
try.
between 150. I'm trying to find the fucking magic like bullet. You know what I'm
It
saying?
might
Like,
not be.
and no, right. And
It
I may
might
just
not
give
be, and
up
it
and just
might
go to
just
150 and say that's
yeah.
where it is. But
Yeah.
I'm trying to find the perfect sweet spot to like,
The only other thing I could think of would be we could bump the HCG up a little bit. Okay.
hmm
Or and I know this became a question too, and I think you didn't ask it was because you were talking about beforehand was pregnenolone and DHEA.
mm,
But we'll tackle that another time because I think
yeah,
that's going to be a lot longer. We're already over an hour, so
yeah, yep. All right. Well, Josh, you enjoy your trip.
sounds good.
Um, be safe. It's will there be any problems with the government shutdown as far as flying?
I hope not.
Is that an issue?
I
'Cause
mean, as of right now, I haven't gotten
I
anything
don't
from
know if it
the
is or not,
I
but
don't think so.
no? Okay.
I think at least the air what I don't know if TSA is getting paid, but um I,
Oh,
I
right.
I don't think I think maybe the airports are paying them or something.
Dude, I've been
You know
so
what I mean?
busy. I just know the government, but I haven't like been watching, but
Just
I know every time the government
listen,
shuts down, it's just a fucking shit show.
it's stupid. Okay, so like here's what you do. Don't shut the government down. Literally have a vote that just gets the people that need to be paid.
Yeah.
You don't need to throw extra shit in
Right,
there. You don't need
right.
just fucking pay the
That's
people.
so gross.
That's it. Done. Stop holding
Here's the
this or
thing.
that or
The
just fucking
politicians, they
pay the
get
people.
paid though, no matter what, right? Like they still get paid.
It's fucking
Oh,
stupid.
gosh,
Just
fucking scumbags.
just fucking pay the people. Get the government back open so the people that are
Yeah.
working at least can
There
get
should be a
paid.
rule like punishable by death that when like that you can't do these kinds of things. It's the same thing when teachers go on strike. I'm like, you motherfucker, you had 3 months to figure this shit out. Like you guys were just hanging out on the beach, ripping cigs
I
all day.
know.
Like you could have fucking sent a couple emails. Like, no, you wait until the first week of school, and then like that shit drives me
I
bananas,
know. I know. It's
And then these
it's always
pricks do the
like
same thing.
right. And I feel bad for the government workers,
Yeah,
I'm
well,
like,
that's what it always is. And it's not
because
even the
they're the ones
teachers
that suffer.
themselves. I shouldn't say the teachers because it's
Like
the
teachers
union,
unions.
right?
Yeah.
It's not the teachers themselves. They just have to do it. But
Right.
it's it's always the people at the top. They shit on the people on the bottom.
Yeah. Everybody else gotta, deal with
Yeah.
it. It's like it sucks, man. I just don't know why they can't just get that shit taken care of. You want to tackle the other shit, that's fine.
hmm
Take care of the stuff that needs immediately done, prioritize. This is why the government is just too big.
Yeah.
They are not efficient at
No,
anything.
not efficient. They're terrible.
Terrible.
And
Waste fucking
somewhere they
money
lost
on,
the fucking Epstein list. I get that just fell between the cracks
yeah.
somewhere.
I don't think even I know we're getting ready to wrap up, but I don't even think even if the Epstein list came out that it would be like this massive smoking gun that everybody makes it out to be.
No,
Well,
I don't
And
think so
real
either.
okay, so all right, so let's say there's people on the Epstein list. Let's say they're on a list, okay, and they're like, okay, maybe they did go to Epstein Island. Great, then what?
Yeah, but that's the thing. You don't know because what it doesn't mean that they were doing anything.
Correct. That's what I mean. Okay, so like
Right.
they were in
You
his
just
plane. They were
everyone
on it.
insinuates that they were there with children, and that may not be true.
Well, it's
That's
just
the
like, okay, so or you know, like, is there any proof that they were? Like, there's no other
right,
evidence,
right.
right? So this list, everybody keeps focusing on it.
You just have to
What's it
think
going to
that this
solve?
guy had to have cameras, had to have so much shit.
I'm sure, but I just
God,
think it's one of these things that I don't know. It's just, I think everybody's just waiting for, like, they're
there's going to be
salivating. They're just
conspiracy theories.
waiting
That's
for
what.
this new juicy thing to come out. And meanwhile, I'm just like, dude, are UFOs real? I mean,
Oh, for real. Yeah, dude, we
is
could do
is
a
Three
whole.
Eye Atlas a spaceship?
I
I
want to
don't
start
know.
a whole fucking podcast about UFOs, man.
I think we should. I think
I
that'd be
fucking
conspiracies
love conspiracies and
and
UFOs.
UFOs. Yeah.
Let's get everyone a question. Would you want to do conspiracies, UFOs, and TRT and just like lump it all together?
Lump it all together.
Fucking yeah. It's like so when the
I think
aliens
that'd be
come
pretty
back.
good. It would definitely be a very good variety show,
Yeah.
variety podcast covering
And
a
if there
lot
is
of good
aliens, we can
topics.
get them on the podcast and we
Yeah, we could
can
get
ask
some
them questions.
special panelists on
Because that rock, I guess that's coming, is an alien spaceship that people think.
yep.
So we'll see.
We'll
So,
see. All right.
all right, Josh, have fun.
Sounds
We'll see
good.
you when you get back. And if anyone's had any questions, you know where to find us. You can email me, the TRTDad at Gmail. Don't email Josh, he's on vacation. You can
Yeah.
also
You
hit
can
me up on
contact my clinic
TikTok.
though, because the girls will be there.
Yes, Josh's clinic will be.
I
Follow
can't.
Josh on TikTok. He's got some new videos that come out. And also, just one more thing. If you guys, I know I've said this a bunch of times, but messaging us through the podcast, I get the messages, but I cannot respond. So if you think like, oh, I sent this guy and he never responded, I can't do it. I can't. There's no way for me. I have no contact information at all to get back to you. So if you wanted to respond, you can do Spotify. I can respond. TikTok, email. But when you go through the actual web, I guess it's Buzzsprout. That's when you click on there. It just comes to me as a fan mail, and there's nothing I can do. So I'm not an ignorant prick. I do try to get back to everybody, but that's the
Yeah,
case.
you do.
So, yeah. So, all right, Josh, enjoy
Alrighty.
yourself. Have fun.
Sounds
Everyone
good.
else, be good.
Later.